Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And it is with great honor that I'm representing the Alzheimer's disease, Parkinson's disease, the international conference on this, and related neurological diseases. So I've been selected to present this, and the title of this presentation is The Impact of Socioeconomic Status in the Association Between Alzheimer's Disease and Mortality. So let's go ahead and get started. So if we look at this, cognitive dysfunction is considered one of the top 10 causes of mortality. There have been no new medications for 20 years, and we were trying to investigate if socioeconomic status is playing a role in cognitive dysfunction versus overall mortality. So what was the methodology? A population-based cohort study of 1999 to 2002, and this is from the National Health and Nutrition Examination Survey, which is a nationally representative data set. And of course, individuals who were age 60 years or older were assessed for cognitive skills. And this is from the Digit Symbol Substitution Test, DSST. And the outcome, what I did is provided through December 2015. And so this allowed for longitudinal analysis between cognitive decline or dysfunction and overall mortality. So Cox regression was used for this section. This is a model that I used to demonstrate this key relationship here. So on the level of cognitive dysfunction and all-cause mortality, that is kind of a primary relationship that we're looking for. And then if you look at poverty income ratio, that modifies potentially the effect of cognitive dysfunction over all-cause mortality. I'm going to be explaining this a little bit more in the subsequent slides. So mean follow-up ended up being about 11.2, a little bit more than I'm used to because the original years that we were following a cohort was much earlier than I'm used to. So the percent of death from cognitive dysfunction, I called it low cognitive function. In reality, it's cognitive dysfunction among the population were higher among Hispanic Americans than Caucasians. In terms of all-cause mortality, the overall unadjusted hazard ratio was 2.74. Let me go ahead and, instead of reading this, visualize this. So as you can see, and the numbers are a bit hazy here and small, but bear with me. So 1 was the reference, and the idea was to have that dashed line right at 1. It's a bit above 1. The reason 1 is important is because that's where everything is not significant. And so 2.78 was considered, 2.74 was considered the hazard ratio for cognitive dysfunction. And then when you looked at poverty income ratio, when it was much less, so individuals were impoverished, then of course, and then cognitive dysfunction together caused a much higher propensity for death than individuals that had not had poverty, experienced poverty. So more numerically, individuals that had experienced poverty and cognitive dysfunction were 208 times or 3 times more likely to experience this than individuals that in fact did not experience cognitive dysfunction. So the amount comparison we were looking for definitely demonstrated effect modification. What are the conclusions? Low cognitive dysfunction, of course. Low cognitive function or cognitive dysfunction leads to higher mortality. The second one is a bit blurry. Individuals in low socioeconomic status experience poor outcomes from lower cognitive dysfunction than those individuals in higher socioeconomic status. And this is really important because it points to the fact that cognitive dysfunction and decline is actually tightly connected to social determinants of health, and economic stability has something to do with cognitive outcomes of cognitive function or dysfunction. Improved identification of dementia, increased surveillance efforts in addressing issues in which poverty and economic stability is assessed for is especially important in family practice, and also in some of the specialty groups where Alzheimer's disease is taken care of. Thank you for listening. If you have any questions, you can email me as well. Thank you.